57 interviews in emergency medicine as an IMG. I have a very special guest today who crushed it in this year's match for emergency medicine. And I brought him here to talk to you all about the secrets of matching into emergency medicine as an IMG. Welcome, Williams, to the channel.
Hey everyone, thanks so much for having me. I'm excited to be here.
So in this video, we will discuss William's journey and talk about the nuances of matching into emergency medicine as an IMG, especially that it's getting more and more competitive and it's getting more attractive as a specialty for international medical graduates who might not be familiar with this specialty in their home country. So what we will talk about today is your journey, things that are specific to emergency medicine, especially the rotations section, which is kind of challenging for IMGs to get into. We'll talk about the letters of recommendation, the importance of scores, research, and then we will wrap with some advice about interviews and any overall thoughts you have about emergency medicine for IMGs.
Perfect, let's do it.
Awesome. So why don't you start by introducing yourself to our viewers, where you're from, where you did medical school, and then we'll start a discussion related to emergency medicine.
Yeah, for sure. So I'll tell you a little bit more about myself. So my name is Will. I'm actually originally from Canada. I did my undergrad there at the University of Western Ontario in physiology and pharmacology. Once I completed my undergrad, I applied to medical school and I attended medical school at the University of Queensland, which is based in Australia. But I actually did med school in really three countries. Year one, I did in Canada because COVID, they closed the borders. So we weren't able to go to attend medical school in Australia. So we did most of that online. Years two and three, majority of it was in Australia. And then year four, majority of that was here in the US, where I completed a lot of my EM and other core rotations for medical school. Recently graduated from medical school, just finished applying to the match. And I matched my number one choice at Albany Medical Center for emergency medicine.
Congratulations, that's amazing. And Will just matched a few days ago, so we have him fresh here out of a successful match to tell us all about EM. So let's start by asking about the step scores and the USMLE exams. When did you start preparing for that? What is the importance of scores for matching into a good EM program?
Yeah, so great question. And I think that this is also an answer that's going to differ depending on everyone, depending on their med school program and things like that. But for me, I try to align my medical school content with my USMLE studying. So, for example, if I was doing cardiology and med school that month, then I would try my best to align UWorld questions and UWorld content to cardiology at that time. But I did USMLE Step 1 in between years two and three. And USMLE Step 2 was in between years 3 and 4. And I'm studying currently for USMLE Step 3 and trying to get that out of the way before I start residency. Hopefully, it'll lighten the course load a little bit. But my recommendation is definitely to start studying earlier and try to do it longitudinally rather than cramming it all in. And after just the second part to your question, in terms of the importance of scores, I would say that it's the second most important factor to your letters of recommendation. That's pretty specific to emergency medicine compared to other specialties. And I'm sure we'll talk about that after as well.
Awesome. Yeah, and it's important to get a decent score, but just be mindful that you don't need crazy scores to match into almost any specialty, even the very competitive ones. After a certain degree, it doesn't matter too much. Like if you score 268 or 272, I don't know if people would make much of a difference for that. And look at the NRMP data. Each specialty has like a average score for people who match in that specialty, and see where you'll see that majority of them have kind of similar average around 250. But you can look at each specialty, and they divide it also by the type of applicant. So if you're a US student, if you're IMG, non-US IMG, so just consider that. But I'm saying that because I see some people spend so much time on the USMLE exams, like year, sometimes year and a half, trying to get like 5 more points and 6 more points.
Yeah.
Don't do that, because you can do other things that might help you more on your application. And now we go to like very important part when it comes to applying to EM, and a big challenge for IMGs, and you can talk more about that, why it's a challenge, which is rotations and securing LORs from these rotations for EM. Can you tell us more about that?
Yeah, so in emergency medicine, they actually really emphasize your letters of recommendation because it speaks to your performance on rotation. And it also really standardizes, I guess, or compares your performance to other people's and speaks to also your personality as well. So within emergency medicine, they really emphasize an SLOE or a standard letter of evaluation. And there's different types that you can use. So there's four main types in emergency medicine. The first one is going to be the most important, which is an ESLO, and that's specific to emergency medicine, where there's a designated faculty member, usually a clerkship director, who has access to this, and they write an ESLO for all the rotators who are applying to emergency medicine from their specific hospital. It's also important that you know that these have to be done at a hospital that has an emergency medicine residency program. It can't be a community hospital where they don't have an emergency residency because they won't have that designated individual to write those letters. And I guess the purpose of this is that it really allows you, again, more standardized comparison among your colleagues and different applicants because that one person writes all of these letters compared to if you ask someone else where they might write one letter an entire application cycle and it's more inclined to be higher ranking. The other types is a subspecialty SLOE, and that's done in subspecialties of emergency medicine. So that could be ultrasound, EMS, critical care, pediatric emergency medicine. And that could be written by any faculty member at any hospital, but usually I'm trying to aim for one with a residency program. The other one is an out of specialty letter or standard letter of evaluation, an OSLO. That's written by any specialty and any faculty member outside of emergency medicine. And the last one is just your standard letter of recommendation where it's a long letter. Something else too that I will mention is that these letters use score systems rather than your standard comments or standard long letters. And that is really to compare your performance to other people's performance and other rotators that they've evaluated.
So they have certain questions that they need to answer and compare to other people in addition to the text of the letter recommendation.
So the only text is actually comments, and that supports the scoring. So they'll ask you, why did you give this person a 5 out of 5? Or speak to why you gave them a 1 out of 5 for communication or for competencies and things like that. So there's really no written like paragraph sections other than the comments.
So it doesn't look like the regular traditional letter of recommendation.
No, it's actually like a scoring system, 1 to 5 on different attributes, almost like a rubric per se. And after they have an opportunity to give comments to justify why they gave that person that score.
Interesting. And we will leave in the link of this video a blog that Will actually wrote that talks more about the different slows and maybe examples about that as well. We will add that to the blog so you can see an example of how one looks like. So now going back to this letter of recommendation, these have to be obtained from a US physician or they can be done by a physician from your home country.
So the e-slows in particular, they have to be done at an American hospital with an emergency medicine residency programs. The other ones, it's recommended that it be from a board certified physician within the US. And after your third letter can sometimes perhaps be at other institutions or other countries, as long as it relates and speaks to your clinical character. So I'll also speak to this. So CORD, the Council of Emergency Residency Directors for Emergency Medicine, they're the ones who basically set out the guidelines and standards for applicants and for residency program directors. And they also make recommendations that help applicants. So for instance, the most recent cycle, they recommended that every applicant have two ESLOs, which have to be based in the US. One from usually a home program and the other one for a visiting program or like an external rotation or elective that you do. And after the third letter can be any of those slows, the O slow, subspecialty slow, and yeah.
Okay. And as you can see, for people who are interested in applying to EM, these are nuances that does not exist in other specialties. So you might be familiar with the application process to IM, to FM, surgery, but this is a nuance that does not exist in other specialties. So that's why if you're interested in applying to EM, I highly recommend you talk to someone experienced with this process, like Will, like any of our other EM advisors or other EM experienced people that you might know. And if you want to schedule a session with him or any of our other advisors, I'll leave the link for that in the description of this video. Because again, you wanna optimize your chance of matching, and you don't want to go into the match like, oh, I did not know that, and now you're applying to all these programs that do not give you an interview because of these things that you missed on your application. So it's very tricky, well, because it's very hard for IMGs to get these LORs. So you're saying the recommended is to get two SLOEs from an emergency medicine physician in a EM residency program. But it's very hard to
Yeah.
get these rotations. So can you tell us about the different types of rotations and how can IMG get an EM rotation?
Yeah, so I mean, the first and the best advice that I can give you is making sure that you seek out these opportunities earlier on in your training. The earlier that you prepare for these opportunities, the more likely you are to succeed in getting one of those external placements or as a visiting student. And
Mhm.
there's two main resources that you can use. The first one is VSLO, or the Visiting Student Learning Opportunities website. And after the second one would be the EMRA Visiting Student Rotations website. And that's specific to emergency medicine, while VSLO is just generic to all other training programs and specialties. Um, and also, too, something else that's also important to highlight is the fact that CORD, which is for, again, specific to emergency medicine and residency program directors, they actually did a survey of all the residency program directors, and they said that SLOES is the biggest determinant or factor in determining whether these program directors would issue applicants interviews. So this is why I said that the SLOES comes above your scores, in that you should really be emphasizing your time, trying to get those SLOES, making sure that your performance on these rotations are like as best as you can be, and making sure that you just don't have any red flags on your application, like making sure you pass step 1, 2, 3 on your first go.
So VSLO might be challenging for a lot of IMGs because their schools don't even participate in the VSLO. So the other website you mentioned, do they allow all medical schools to participate in, or also it's limited to certain medical schools outside the US?
Yeah. So my understanding of it is that it really just helps applicants be aware of which programs are accepting rotators and visiting students. However, you can also be reaching out to these programs that you see on the EMRA Student Opportunities database. You can also perhaps reach out to programs that are known to be on VSLO, larger institutions, reaching out to them and seeing if perhaps you're able to do a rotation there. And after, in terms of some barriers, obviously there's a lot of barriers to, especially IMGs, to doing rotations in the US. The first one is visas, making sure that you're able to be in the country and being able to be pursuing these opportunities. The second one would be these agreements that have to be made between your medical school and the visiting, or like the host institution. And that can take a long time for those agreements to actually come to fruition, and that it could take upwards of 6 weeks for those agreements to be established. So that's why it's really important that you start seeking out these opportunities earlier on, allowing for your medical school to help you in the best way possible.
For sure. And we have actually on the Match Guy website a list of rotations or electives that let you participate in, even if your school is not part of the VSLO. And I'll leave the link for that in the description below. You can get it fully for free if you sign up to that. Uh, well, I want to go into the details of this discussion because I want people to be aware of the challenges associated with getting a rotation EM. So both of these options you mentioned are electives. So people have to be medical students at the time of doing them, correct?
Yeah, that's correct. Yeah. A lot of these institutions will only take on current medical students. And I think a large reason for that is medical student malpractice insurance, that you have to have in order to train at at these institutions. And usually most medical schools, whether you're an IMG or a US medical graduate, or medical students, usually your medical institution will have those. So that's why it's really important to seek out those opportunities while you're a medical student.
I see. So what about medical graduates? If they graduated already from medical school, do they still have any options to do an EM rotation?
In terms of an EM rotation, I think it's going to be much more challenging. However, there's other opportunities that you can pursue. For example, research opportunities within EM institutions,
Mhm.
um, working with EM faculty that are doing large research projects, and that's a great way to establish connections with these programs. And also, too, some of these programs will also offer you an interview because they already know you. They already know your
Mhm.
character. They know your personality, which is a huge factor in emergency medicine. They want to make sure that you have a personality that aligns well with the institution's values, that you get along with all the residents, because EM it really is a team sport.
That is, brings us to our next point, which is research. People who watched me well enough, you know how a huge advocate for research I am, because
Yes.
I really believe it's we have a saying in Arabic that says, if they kick you out of the door, you can come from the window. And if you can't get rotations through the door, which is like the official way of getting an elective, I believe research is this window that you can get access to amazing mentors because you don't have the option of rotations. So research is when we just were doing this research positions workshop in which we educate people on how to find research positions in the US. And one of the main values of that, in my opinion, is building these connections, because sometimes once you build these connections, attempts might not matter, your scores might not matter, even letters of recommendation might not matter, because they like you. As you said, they like you so much and they would just want to keep you in there. So can you tell us a little bit about your research experience, how important research for EM applicants is?
Yeah. So in the field of emergency medicine, they definitely value research and that it's an opportunity, but you won't necessarily be penalized if you don't have it. So just like Dr. Assad was mentioning, if you build these connections, you're more likely to have an advisor to make a phone call to another program director. It's just another opportunity that you should definitely seek out. And also, too, it's a way that your application stands out. For me, I had around 10 to 12 research experiences on my resume and my CV. And I think that's what made me stand out as an applicant as well, compared to others who had an average around 2 to 3 interviews for a US IMG. And for non US IMG, it's around 7 research experiences. So I think it's just a great way to stand out compared to other applicants.
And it's not about, for our viewers, not about just the number of research experience, just adding things on your application. It's the value that you bring from these experiences. What did you learn? How many publications you got? It's not just a number on your CV.
Yeah, and I also think too, it's that one research experience, you can really stretch it and you can make the best use of it in that you can present it at a local conference, you can present it at a national conference, you can publish an abstract, and you can also try to get a publication out of it, like as in a full manuscript. But again, I think the most important parts of it is that it's a great discussion point during residency interviews. It's a great way to build connections to other applicants, to other program directors, residents who may be more likely to make a phone call on your behalf. They might be willing to extend an interview at the institution that you did the research at. So again, it's just a great opportunity to seek out.
Exactly. And now let's move on to talk about the application itself, optimizing your personal statement, your application, interview tips when it comes to EM interviews.
Yeah. So I think that this is a loaded question, that there's a lot of parts to it, and there's a lot of opportunities to potentially make mistakes. And you got to really understand that an application season starts really when you enter medical school, and the way that you tailor your application, the way that you are able to build your experiences, get those research opportunities, that's something that you can't just do last minute. So that's the first thing, is making sure that you, in a way, visualize what you want your CV to be and just try to build that over time. And after, in terms of the application, the first part of it is deciding what programs to apply to. My advice would be to over apply rather than under apply. Either you get a lot of interviews because you over applied and that's just more opportunities, or you wouldn't have gotten as many interviews and you were at risk of going unmatched if you didn't apply to as many programs. It's also really important that you recognize what type of applicant you are, and that if you are an IMG, you should definitely be seeking out IMG friendly programs. And the Match Guy has a lot of great resources on the website that I actually used as an applicant in terms of what programs I should be applying to. So it allowed me to be strategic about that. I think that it's also important to not be shy to reach out to programs to gather more information about it, especially if you're really interested in the program. Whether that be finding a reason to ask a question like, what are hour shifts do you have? Do you have any more information sessions coming up over Zoom? I would love to attend as I'm really interested. So don't be shy to reach out to these programs early on. Once you've submitted your application, then I think the next part is preparing for interviews. Making sure that you're prepared, that you anticipate the questions that they might ask, and make sure that you have responses. Don't sound like a robot, but make sure that you have some good talking points to some of these questions that actually is on the Match Guy as well, that I and my partner used when applying to help us prepare for those interview questions. And also, too, the next and probably the most important thing is, again, to reach out to programs to express your interest. Now, this can backfire if you don't do it properly, in that you have to make sure that you send individualized emails to program directors and to a few handful of program directors that you're actually interested in going into their program. If you send a generic email, they know that you're sending that to many programs. So it's really important that you send individualized emails, especially to the places that you have connections to. If you lived in that city for a few years, if you did your undergrad in that city, or you did research in that hospital or institution, definitely reach out to them, because it could just be another missed opportunity.
Awesome. These are very great tips when it comes to applying. And I love the point that you mentioned that your application starts from the time of you getting into medical school. Because we get some applicants and they need help in September, like a few weeks before the application.
Yep.
And we can do our best in your personal statement and editing your application, but we can't just make experiences magically appear on your application. These are the result of your long time of hard work and dedication that starts from the time you enter medical school or even before. So if you need help, I think now, like, even yesterday was the best time to seek that help.
Yeah.
So we can talk to you about the different things you can add on your CV, and you have time to work on these things. But for those people who are looking for editing their personal statement, ERAS application, help them with interviews, we have a phenomenal team of amazing advisors who are ready to help you, including other EM advisors, other advisors from all different specialties. And we trust their work so much that we made all these services 100% satisfaction guarantee, which means if you're not happy, we'll literally give you your money back. So even after you do the session, if you don't like it, we'll just give you your money back, because we trust we're providing value to you. When it comes to personal statement and ERS application, what kind of things do you recommend putting or not putting, or some mistakes to avoid when it comes to these two important sections of your application?
Yeah. Yeah. For me, the way that I view it is that personal statements are possibly missed opportunities to really stand out among other applicants, and it can really hurt you if you don't do it the right way. For example, tailoring a personal statement to the specialty that you're applying to. An applicant who's applying to pathology is going to have a very different personal statement than an applicant who's good be applying to emergency medicine. So making sure that you understand those distinctions and making sure that you really tailor your personal statement. Something to also keep in mind is that your personal statement can actually be individualized to each program. So I'm not saying that you have to have a different personal statement for every single different program that you're applying to, but pick your top five and individualize your personal statement. In your last paragraph, talk about why you really want to go to that specific program, or out of all the signals that you have allocated, write an individualized personal statement for them, because on the ERAS application, you can actually allocate it to individual programs. And in terms of just general information about the personal statement, you want your personal statement to tell your story in a way that's clear but also interesting. You want the reader to want to extend an interview to you to meet you. So, for example, the theme for my personal statement was that I'm a curious person. I'm one that has always been motivated by challenges. And I sort of worked my personal statement around that theme. And I think that that's something that the interviewers really remembered about my personal statement, and and they wanted to get to know me. So leaving them with that a little bit of curiosity about your personality is always a good thing.
Yes, I 100% agree about this idea of people wanting to meet you. You want to read somebody's personal statement and you want to say, oh my gosh, this seems like an amazing applicant. I want to get to
Yes,
know them and talk to them and learn from them something, I maybe
exactly.
wasn't aware of. So
And
these are very, very good points. And for those who don't know how a personal statement looks like, we actually have phenomenal resources that are available fully for free for you. And I'll leave the link for that in the description below. Samples of how a personal statement looks like, how to write a personal statement, examples of the ERAS application, a filled one, so you can see how to tips on how to fill the ERAS application and how a filled one looks like, in addition to so many interview prep resources like interview questions, answer to these questions, and you can get these fully for free by signing up in the link that I'll leave in the description below.
I will also say that your personal statement, you don't want it to be a reiteration of your CV. You don't want to just tell the interviewers again all of your research experiences, all of your work experiences. You want it to really speak to your personality. You want to tell them why you want to go into that specialty and why you are a good fit for that specialty. So, an important distinction to make as well.
Exactly. And another thing is make your personal statement, not your patient's personal statements, because that's a theme I've seen a lot among applicants, like two huge paragraphs about how, a patient presentation, what they did, and the imaging and the labs. I'm like, this is not, Mr. Smith personal statement. This is your personal statement. So try to
Yes.
not make it like a patient presentation and treatment plan, all this kind of stuff, because the space is limited. Well, now I want to talk about something that might not be related specifically to the application, but might be interesting to the viewers of this video, which is emergency medicine as a specialty. In a lot of countries, that specialty does not exist, or it's in infancy. So people don't know much about what does it entail in the United States. What's your scope of practice and your opportunities afterwards? So why did you pick EM, and what kind of things do you do during your residency and your job opportunities afterwards?
Yes, that's a great question. And I think for me personally, why I chose emergency medicine was actually based on my previous experiences. So a little bit untraditional, but it was actually veterinary emergency medicine that really brought me into the field of emergency medicine. I worked at a large emergency referral veterinary hospital, and I loved everything about it. For me, I loved that every patient that walked in through the door was a challenge. And that goes back to my personal statement in that I love challenges, whether it's a patient that needs to be worked up because they're completely undifferentiated, or you have a really sick patient that you have to stabilize. No matter how you view it, they're really a challenge. I also really like to be as functioning as part of a team. That's something that's really important to me. And I don't think that there's any other specialty out there like emergency medicine that's more team based, in that you get to work with nursing staff, respiratory therapists. You're consulting every specialty in the hospital at all the hours because of a patient that you have. So that's something that was really important to me and that's really intrigued me. In terms of other opportunities, I think that there's so many opportunities following your emergency medicine residency, and the door is open. Whether you want to pursue fellowship, you want to pursue community practice, you want to practice in an urgent care setting, there's so many opportunities afterwards or after residency. For me personally, I'm potentially hoping to pursue critical care fellowship. You can do that through emergency medicine as well as internal medicine. And also too, there's more opportunities expanding. So, for example, there's a lot of applicants going into sports medicine, pediatric emergency medicine. I think the opportunities are endless.
I've seen toxicology as well. Uh,
Yes.
so, there's a lot of options after EM. And there is so much need for emergency medicine physicians that the job market is, it's a good job market if you're interested in working in a specific location, because sometimes if you have a very niche area of practice of medicine, you might be required to go to certain areas where they have these type of jobs. I feel like EM, there is a lot of job opportunities, and you'll be able to select the location of where you want to live after your residency.
Yeah, I totally agree with you. And I also think, too, that the field of emergency medicine is also one that's evolving rapidly.
Mhm.
More recently, is the changes that's actually undergoing in emergency medicine residency programs. In that a lot of these residency programs actually started off as being 4-year programs. Most of them transitioned into a 3-year program, which is what I applied to. And there's a few 4-year programs still out there, mostly the academic programs like Boston, BU, Washington University, Harvard, Yale. However, there's actually a push right now by the ACGME to now make emergency medicine a 4-year program across the board again. So it's going to be interesting to see how that plays out, and how that also affects fellowship training afterwards as well.
Exactly, exactly. It's a very rapidly evolving field because it's a recent, field. People have been in emergency medicine for a long time, but as a specialty, it's not, an old specialty, and that's why in these new specialties you see more rapid development rather than specialties that have been there for a long time, like ortho, neurosurgery, and others.
Yeah, for sure. Like a lot of the times, like prior to emergency medicine residency programs, it was actually internal medicine who would staff the emergency department, or general surgery who would staff the emergency department. But now there's emergency medicine residencies who specialize in emergencies. They specialize in an undifferentiated patient or a critically ill patient and stabilizing them. So I'm glad that that need has been fulfilled for sure. It was much needed.
Exactly, and that's actually when I was in Syria, it was like exactly like what you were describing. There would be like an ortho person, ortho resident in the ED. There would be a general surgeon in the ED, and IM physician staffing in the ED. So there was at the time when I was there was no full EM residency. So it's interesting to see how things changed.
Yeah, and for sure they're not going anywhere. Emergency medicine residency programs, and it's definitely for the best.
So over the last few years, we've seen increase in the competitiveness of the specialty. I remember one time there was almost like 500 spots unfilled, and now the number of programs is increasing rapidly. A lot of the spots are getting filled by DO students and the expansion of DO schools. Can you give us an idea about the competitiveness of the specialty, especially for IMGs?
Yeah, so as you said correctly, I think that emergency medicine is becoming a more competitive specialty for a variety of reasons. That being, there's so many more opportunities that allow, that emergency medicine graduates can go into, like critical care, sports medicine, toxicology, so many opportunities, and also lifestyle as well. In that they'll have 12-hour shifts, perhaps 3 12-hour shifts in a week, and they have the rest of the week free or to themselves. But in terms of some of the numbers, in 2023, there was 554 spots. 2024, there was 135 spots, unfilled, and most recently there was 65 spots that were unfilled. I think that maybe next year or the year after, there's going to be zero unfilled spots, shortly coming.
Yeah, it's a great specialty for people who can tolerate the hectic environment of the emergency room because I don't believe this is a specialty for everyone because you're right, it's like 12-hour shift, few days a week, and you have the rest off, but the surveys show they have a very high burnout rate, and I believe because of the non-stop environment. When you're there, you're just non-stop working. I've never seen an ED where people are just chilling and doing nothing.
No, for sure. It's definitely not for everyone. And I think that also recognizing what you're going into is really important. And that's why there's such a large emphasis on your SLOEs, on the
Mhm.
interview portions, because they want to make sure that you're a qualified applicant for those positions. They want to know that you've endured or you know what you're getting yourself into by having those rotations in the US at an emergency medicine residency program, for sure.
Well, that was a phenomenal and insightful conversation to talk about EM and the match process for that. Any final thoughts regarding this process and advice for people pursuing EM?
Yeah, I think that the application process going into emergency medicine is very different compared to other specialties. So I definitely think that it's important that you seek out advice from either an advisor, learn about the process earlier on, and definitely start your application earlier on in the application season, as early as third year, to preparing for those, rotations in the US and making sure that you meet all the requirements. I think that's my number one advice is just get it done early. And after my second advice is making sure that you advocate for yourself throughout the application season, making sure that you reach out to programs, express your interest, making sure that you express your excitement for the specific interview that you're at. Because I think something else that's really important is that residency programs want applicants who are genuinely happy and excited to be at their residency programs. And the best way to do that is by seeking out applicants who have ties to the area, who have expressed an interest in their specific program. So make sure that you express that interest throughout the application season.
Thank you so much. Thank you so much for spending this time with us and for this extremely valuable advice that you shared with our viewers. For our viewers, as Will said, if you need any help, we're more than happy to help you. Just reach out to us at info@themagi.com or click on the links that I'll leave in the description of this video. We'll be thrilled to help you achieve your goal of matching into residency in the US. If you find any value in this video, I would really appreciate it if you hit the like button, subscribe to the channel, and share this video with another applicant who's applying to EM to help them with this process. Thank you again for tuning in, and good luck on your match.